Hi, welcome to Group 6's presentation on emergency procedures for the exposure of hydrofluoric acid, hydrogen cyanide, and phenols. In this presentation, we will be going through a few sections. Number one, we will explore hydrogen fluoride acid. So we will also explain the case studies that have happened before. We will also look into next is HCN or hydrogen cyanide. Okay, we will look at the hazards. We will have a look at how it is treated if exposed, and a case study on that. And for the third part, we will be exploring on the emergency treatment for phenols, and we will also close this presentation with a summary. Okay, for the first part, we will go to hydrofluoric acid.
Hello everyone, my name is Priya Murugan. Today I'm going to present my part for the presentation, which is emergency treatment for HF. What is HF? Why does it sound so serious and dangerous? Let's see. HF, hydrogen fluoride, is a colorless gas at 25 degrees Celsius, and its aqueous solution is known as hydrofluoric acid, HFA. HFA is an inorganic weak acid with a very strong tissue corrosiveness. It can produce a very severe tissue damage or severe systemic effect if we get exposed to HF. So the degree of tissue damage that can cause by HF is always depends on the concentration and the involved area. This is a case study regarding HF taken from a medical journal. In this journal, it has stated that 31-year-old of male patient who was working in a glass manufacturing industry presented to a burn unit in an hospital. After he had a very severe HF burn that caused by the explosion of 5 liters of acid container. So during the physical examinations, doctor found out that the infected person's affected clothing had not been removed and the infected area had not been washed with water after the incident. Even the patient was admitted to a hospital only 1 hour after the incident. This caused the patient to have a very severe tissue damage with second and third degree of burn on that occur in the 5% of his body. So this type of serious and dangerous situation definitely can be avoided if we follow the right first aid measure during the emergency treatment of HF. So when a person get exposed to HF, the first thing that we should need to do is first remove the infected person to fresh air to support their breathing. Second, remove immediately all the contaminated clothes of the infected person. Then rinse the infected area with clean water or take a shower at least for 15 minutes. Then apply 2.5% of calcium gluconate gel on the infected area to treat the burn. Then use hexafluorine solution on the infected area to deactivate the hydrogen ion that can cause severe tissue damage. And finally, immediately call to poison center or admit the patient to nearby hospital for further medication. So these are the precaution measures, fire procedure and spillage procedure. So when we are handling with HF, we must make sure that we wear a proper personal protective equipment such as goggle, face shield, neoprene glove, lab coat, full shoes and cover shoe to keep ourselves safe from the HF hazard. Second, for fire procedure, since HF is a non-combustible, use a fire extinguisher that's suitable to the surrounding environment. Third, for the spillage procedure, make sure we have a spillage kit with us to handle this. And first thing, isolate and ventilate the contaminated area. Then cover the spillage area with a containment socks. Then clean the spillage of acid by neutralizing it with a sodium carbonate. After the neutralization, clean the area with adsorbent pads. Then dispose the contaminated pads properly without cause any further hazards to the environment. That's all from me. Thank you.
Assalamualaikum and good evening. My name is Muhammad Hisham bin Hassan. I will share with you a few slides regarding on the emergency treatment for hydrogen cyanide. Hydrogen cyanide, or simply known as HCN, is a highly toxic chemical. It can exist in various forms, either in colorless, gas, or liquid. In the workplace, the route of exposure is mainly through inhalation. It has a bitter almond odor, but not everyone can smell. I have listed down some of the symptoms of exposure here. In the event of acute exposure, one may experience headache, dizziness, shortness of breath, nausea, and can come to an extent of seizure and cardiac arrest. In the event of moderate to severe, for chronic exposure, one may experience headache, eye irritation, fatigue, and shortness of breath. But these are very rare, as cyanide are metabolized quickly in the body. I have also listed down here the case study that I took from the American Journal of Emergency Medicine. The incident occurred in a chemical trading company in which part of the office was used for storage of chemical products, including a small tank of HCN. However, three small flasks containing HCN were left uncovered or unclosed overnight, and then from the report, the concentration of HCN exceeded the upper limit measured by the Drager tube, and there was no other toxic gas was detected. A 19 years old lady was found collapsed in the office after being left alone for 4 hours, and suspicious that the irritable smell in the office was toxic gas. The first arrival at the scene rescued her and sent her to the emergency department. At the emergency department, she was resuscitated with 100% oxygen, followed by the endotracheal tube for inhalation. She was treated as a case of cyanide poisoning and discharged on day 4. However, even at 1 year follow-up, she still reported mild impairment of recent memory. Moving on to the emergency treatment for HCN, this is the first aid procedure if someone is exposed to the HCN. At first, we have to remove the casualty from cyanide exposure by bringing the person in contact to fresh air environment. And if the person is still breathing, support the airway, breathing and circulation by administering 100% O2. And if the person is unconscious, insert an oral airway using the endotracheal for inhalation. And if the person is not breathing, resuscitate using a resuscitation bag connected to oxygen. And then before you transfer to the casualty to emergency department, please remove all the decontaminated please remove all the contaminated clothing in a sealed bag. Then this procedure is actually it is only safe to do if the first aider has been trained. And then there are some precautionary measures that when attending the casualty, please wear an appropriate PPE such as goggle, glove, and mask. And then for the emergency treatment in the event of spillage coming from liquid and leakages from gases, for the leakages that coming from the gas, please notify the safety personnel, isolate and ventilate the area, and if safe to do, please shut off the source of chemicals and then remove the source of spills to the fume hood. And if it can't be stopped, allow it to empty. And then for the spills that coming from the liquid source, please also notify the safety personnel. Do not wash away the spill down the drain, and then prevent the HCN spreading from entering drain using the absorbent material, and treat with the sodium hypochlorite. In the event of by fire procedure, as we know that HCN gas is extremely flammable, please only use CO2, dry chemical, or foam to fight fires. And if incident happen in HCN are used or stored, please evacuate immediately and then call the fire brigade, and do not attempt. My advice is do not attempt. Just leave it to the experts. Thank you.
Hello, my name is Zainab and I will talk about phenol and emergency treatment of it. First of all, phenol is a white crystalline solid in its pure form, which liquefies in contact with water. It is used as a starting material for a variety of chemical reactions and other processes. It is corrosive, and diluted preparation of phenol solution may also burn the skin. In order to protect ourselves of phenol, avoid exposure to skin. Wear protective clothing, goggles, face shield, gloves, full suit, and boots. In order to study a case of phenol, in April 26, 2018, a 55 years old male patient with several phenol burn complicated with actual poisoning. The patient quickly developed the symptoms of central nerve system and respiratory failure. After series of measures in hospital, including wind decontamination to reduce phenol absorption. Finally, the patient was reduced successfully and discharged after 29 days of that accident. If we talk about emergency treatment for phenol, GHS label elements including precautionary statements of phenols is danger. Hazard statements, toxic if swallowed, in contact with the skin or if inhaled. Causes several skin burns and eye damage. Suspect of causing a genetic defect may cause damage to organ through prolonged or repeated exposure. So, if swallowed, do not induce vomiting. Never give anything by mouth to the patient. Rinse mouth with water. Immediately call doctor. In case of eyes, rinse continuously with water for several minutes. Remove contact lenses if present and easy to do. Continue wash with water and immediately call doctor. If the phenol touch the skin, take off contaminated clothing and shoes immediately. Wash off with soap and plenty of water. Take victim immediately to hospital to take the right procedure. And if inhaled, remove victim to fresh air and keep at rest in a position comfortable for breathing. Immediately call doctor. In order to deal with fire procedure, use water as fog or spray, dry chemical, carbon dioxide or alcohol resistant foam. And finally, spill procedure. Clean up waste regularly and abnormal spill immediately. Avoid breathing dust and contact with skin and eyes. Wear protective clothing, gloves, safety glasses, and dust repository. Use dry clean up procedure and avoid generating dust. That's all for dealing with phenol. Thank you for listening.
Thank you, Zainab, for the presentation on phenols. So the next part is, before we end our presentation today, I would like to summarize some of the points that have been given by my colleagues. Okay, so from these three chemicals, hydrogen cyanide, hydrofluoric acid, as well as phenols, they have different pictograms, they have different danger words. So what we could look into is that all three of them have a similarity that they are very toxic, Okay, the first similarity that we have when we are dealing with hydrogen fluoride, hydrofluoric acid and phenols is that to take off the victim's clothes immediately, and we should also use rinse with a lot of water, and for some which is phenols, we should use soap. Okay, so that's a special part in using soap for phenols. Okay, other chemicals usually we just use as much water as we can. All right. As for hydrogen cyanide, we should watch out for the breathing of the victim and allow the victim to be exposed to a lot of air to help with the breathing. And for spill procedure, we should look into, number one, we have to always notify the safety personnel. Make sure that we tell, if you have a work leader, tell your work leader. If you have a shift supervisor or you have somebody from the lab that is in charge of safety, notify that person immediately. All right. Make sure to go to a well ventilated area. This happens for all three. For in the summary, I would like to focus on that. Go to a ventilated area, allow for the victim to be exposed to fresh air. All right, but a few things that we will have to look into is, for example, for hydrogen cyanide, make sure we treat with sodium hypochlorite. Okay. For hydrofluoric acid, we have to clean the area with adsorbent pads. Okay, after neutralization, we treat hydrogen fluoric acid with sodium carbonate. As for phenols, we use caustic soda. All right, so caustic soda, sometimes we call it as sodium hydroxide. Okay, caustic. And last but not least, fire procedures for the three chemicals. Okay, hydrogen cyanide, we must use carbon dioxide, dry chemicals or foam. All right. Hydrogen fluoric acid, we have to use water spray. Okay. Carbon dioxide can work as well. Foam and dry chemicals can work as well. So, but make sure that the foam is alcohol resistant foam. As for phenols, we should use alcohol resistant foam, dry chemicals and carbon dioxide. So mostly they are almost the same, but for hydrofluoric acid we can use water. And with that, I would like to end my presentation and say thank you for the attention. Bye bye.